Hi, my name is Les Cole, MD, and I practice functional and metabolic medicine. I went to University of Florida College of Medicine and had an interest in biochemistry and cell structure and function prior to that, which has served me very well in my current practice. I practice metabolic medicine, and metabolic medicine is really based on the metabolism of the cells. Our tissues are made of cells, the organs are made of tissues, and the organism, our bodies, are made of organs. So you've heard of heart disease, lung disease, kidney disease, vascular disease. Those are all organs, but the primary dysfunction is the cellular metabolism that has gone wrong for a number of reasons, either genetic inherited diseases or improper nutrients. Putting the wrong things in your mouth, breathing the wrong things into your lungs, and not putting the right things in. Those are the nutrients. That's what runs our cells. Actually, there are quite a few studies coming out lately that indicate that most chronic diseases are due to malnutrition of one form or another. Micronutrient deficiencies, which are actually common in people who are obese, overweight. They're getting too much of certain kinds of foods or nutrients, but too little of the ones that are important for making our cellular metabolism work right. So one of the ways that we identify particular problems is by ordering blood tests. Our allopathic brethren, they order a specific panel. We order additional tests, the ones that are being shown in the current literature to be of value. High sensitivity CRP, homocysteine, fasting insulin, adiponectin. These are tests that you can get out of your regular lab, but you have to request them as the physician in order to get them. It turns out that you can pick up most of the diseases of aging, most of the chronic diseases, well before they begin. And so we catch these things early, and these things can be prevented. And they can be prevented by doing good nutritional assessment, by doing specialized labs that can identify deficiencies, by increasing whole foods, improving the diet, and decreasing processed foods, decreasing fast foods, and helping someone get into an exercise program and also some type of program that begins to reduce their stress levels. Patients who have significant metabolic abnormalities because they're not eating right, plus they may have a genetic defect of some sort, some of these can be overcome simply by providing extra nutrients. We also do bioidentical hormone replacement. Hormones are extremely important to the body's functioning. They are the signals that tell our cells how their metabolism should work. Vitamin D is actually a hormone. It enters the nucleus and it turns on and turns off certain genes which guide the metabolism of the cells. Vitamin A is the same way. It enters the nucleus. Estrogen, testosterone, all of the sex hormones. They enter the nucleus, they tell the genes which ones to turn on and which ones to turn off. Extremely important. And one of the things that we've noticed is that when people age and their hormones diminish, they begin to develop more disease processes. I treat both men's hormone issues and women's hormone issues, and the entire age spectrum. IV therapy is a big part of our practice. Lots of minerals, lots of vitamins, generally high vitamin C content. Pre- and post-operative IVs are a big part of our practice as well. There are studies out there that show that about 70% of the American population are malnourished, and with both macro and micronutrient deficiencies, healing does not occur as well. And there's lots of studies that show that. More complications, more infections. And so anybody that is having surgery, we have a package so that they can receive an IV beforehand and an IV after their surgery, and this has been shown to greatly enhance their outcome. If you'd like to know more about my practice, you can go to my website. All my contact information is there, and we'd love to hear from you.